Local infectious disease specialist Dr. Steve Threlkeld with Baptist Memorial Hospital here in Memphis gives daily briefings and answers questions about COVID-19. Today, he talked a little bit about people who are at a greater risk of catching coronavirus.
People that we have seen, it has been rather striking what the risk factors have been. People ask a lot, but what have you seen at your institution? Are people older, younger? What are the risk factors for not doing well and or dying from this infection? I would say that in general, we have seen similar things to what the national trends have been. There haven't been any great breaks with those trends and those numbers. The things that sort of strike you when you just look at it anecdotally from what we see, clearly age is a factor. I mean, older age, obviously, I think in everybody's experience, those folks have done worse. But people who are particularly morbidly obese, there's like 10% of America can be, and if you look at those are sort of more than 100 pounds overweight, and if you see that, they tend to do extremely poorly. And it's not just that people with morbid obesity have other underlying associated comorbidities, because it is true that morbid obesity is associated with increased risk of cancers, with high blood pressure, with diabetes, which is felt to be another probable independent risk for this. But I've been struck by the fact that even folks who are just profoundly overweight, even without those other things, because you don't have to have those, many of those people have done relatively poorly. So there are probably a number of issues about that. So that's just for starters. With respect to vaccines, it is widely known that folks who are morbidly obese tend to have a lesser response to vaccinations. And that's been known to a degree for a long time, back into the 80s. And we saw that with hepatitis B. We've seen it to some degree with flu shots. They did a study that showed that twice as many people who got vaccinated for the flu got the infection despite that vaccination.
Always interesting information from Dr. Threlkeld. If you'd like to watch his full coronavirus update from today, just head to our website, WMCActionnews5.com. Search infectious disease in the search.